Today we're going to talk about chronic inflammation. Chronic inflammation is implicated in a number of autoimmune and neurodegenerative diseases such as MS, Parkinson's disease, ALS, also known as Lou Gehrig's disease, and Alzheimer's. Chronic inflammation is also correlated with cardiovascular disease and diabetes, and it's one of the key factors that increases someone's risk of having a stroke. But more than that, chronic inflammation also has huge implications when it comes to neuroplasticity, which is brain rewiring, and neurogenesis. So in this video, what I hope to accomplish is for the majority of you, which have one of the diseases that I just mentioned, and or you are passionate about getting your brain to rewire or getting your brain to build new neurons, what I hope to accomplish is giving you a deeper understanding in a simplified manner of what chronic inflammation is and steps that you can take today to decrease the amount of what we call bad inflammation going on in your system, promote neuroprotection and neuroplasticity, and also decrease disease progression or disability progression if you have an autoimmune or a neurodegenerative disease. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and mindset in the context of neurologic injury, with the end goal of empowering you with as many tools as possible to take ownership of your health and live an overall healthier, more active, more fulfilled life. And with all that said, let's dive right into the topic of today's video, which is chronic inflammation. So we're going to zoom way out, and first let's just define what inflammation is in general. So generally speaking, inflammation is part of our innate immune system. Our innate immune system is like our first line of defense against foreign invaders, bacteria, infections, and tissue damage. So what that means is whenever you have a foreign invader or you have tissue damage, this activates our innate immune response. And once our innate immune response is activated, it deploys immune cells, also known as white blood cells. And what these immune cells do, in particular the neutrophils, is they go in, they first eliminate whatever is attacking the body, the foreign invader or the tissue damage. They clean up the area of any dead tissue, and they start the repair process. And then, and most important, what happens next is they are meant to leave the area. When these neutrophils or these immune cells do not leave the area, that is when we develop something called chronic inflammation. And chronic inflammation is when these immune cells kind of outstay their welcome. And when these neutrophils stick around too long, they just repeatedly produce and release pro-inflammatory cytokines, which are another type of immune cell. And in turn, what this creates is damage to healthy tissues. Now, depending on what system is involved, the mechanisms are a little bit different in how this innate immune response works. When we're talking about blood vessels and chronic inflammation, if these immune cells stick around too long in the blood vessels, they actually stick to the sides of the blood vessels. These turn into foam cells. Foam cells turn into plaques. Plaques then further release immune cells, which keeps this inflammatory or immune process firing, which creates further destruction or damage to the cell walls, which actually causes the cell walls to stiffen. The reason stiff blood vessels are a problem is that blood vessels are supposed to dilate when our blood pressure rises to accommodate for this increased blood flow. When our blood vessel walls do not do that, if our blood pressure goes up or our heart rate goes up, that's when bad things happen. The other thing that happens is these plaques, due to a variety of circumstances also related to this innate inflammatory process, is that they rupture and they break off, and then that's when you have a clot. If the clot happens in the heart, it's called a heart attack. If the clot happens in the brain, that is when you have a stroke. That is extremely simplified, but that is kind of normal inflammation gone wrong and turning into chronic inflammation. When it comes to the blood vessels, chronic inflammation is highly correlated with cardiovascular disease. When this chronic inflammation or this innate immune response goes haywire in the joints, it has implications on the articular cartilage and leads to things such as osteoarthritis, rheumatoid arthritis, and psoriatic arthritis. All three of those have different causes, but it's good to know, and it's important to know, that chronic inflammation is correlated with all three types, all three of those arthritises. I've talked about this before when I've talked about knee arthritis and the importance of keeping your inflammation under control. If you are someone who's been to an orthopedic doctor and they've told you that you have osteoarthritis and you could potentially need a joint replacement down the road, something to be aware of. When we have chronic inflammation in our stomach, it leads to things such as irritable bowel syndrome or inflammatory bowel disease, such as Crohn's disease. When it comes to our lungs, chronic inflammation leads to things such as asthma and COPD. When it comes to our brain or our nervous system, these pro-inflammatory or these immune cells sticking around too long lead to conditions such as Alzheimer's, multiple sclerosis, Parkinson's disease, and ALS or Lou Gehrig's disease. Now, there's one other thing when it comes to chronic inflammation, and that is a hypoxia-induced inflammatory response. Hypoxia is lack of oxygen in the tissues of the body, or a higher oxygen demand than supply. And hypoxia can also activate this innate immune response. And why this is important is when it comes to pressure sores. So any of you that were in the hospital for a long time, if you ended up with a decubitus ulcer, one potential mechanism was this hypoxia-induced inflammatory response. But this is also implicated with diabetic ulcers because of the damage to the blood vessels with diabetes. That leads to decreased blood flow. Decreased blood flow leads to decreased oxygen in the tissues and could be one of the factors that precipitates or keeps this inflammatory process repeating itself in that area and causing cell death. And possibly diabetes in combination with chronic inflammation, which they are correlated, does damage to peripheral nerves. So that's why you guys that have diabetes end up with peripheral neuropathy. When you have peripheral neuropathy, you don't feel when you have a pressure sore, so you don't take care of it. And that's another reason why you end up with diabetic ulcers. So just a little side note on how all of these things are related: diabetes, cardiovascular disease, and chronic inflammation. Now, when it comes to hypoxia-induced inflammation and stroke, big picture, and I know I talk about this a lot, but it's always good to review. An ischemic stroke is when a plaque dislodges or you end up with a blood clot in a blood vessel in the brain. That cuts off blood flow to cells in the brain. When blood flow is cut off, that cuts off oxygen, so those cells become oxygen deprived, and that is what activates the immune response in the brain. Now, the brain has its own kind of immune system, so it activates that brain immune system via the microglia in the brain, which are kind of like the brain immune cells. The other thing that occurs is these microglia start to do their innate immune response thing. They break down the blood-brain barrier, and the blood-brain barrier stops or prevents stuff from getting into the brain, almost like a protective layer for the brain. And then through a cascade of events that also activates the peripheral immune system. But long story short, when it comes to this, is there is documentation that even decades after a stroke, they find these immune cells diffusely in the blood vessels in the brain. They also find foam cells in the brain, which I told you is kind of like a precursor to plaques in the brain. And they find lymphocytes in the blood vessels in the brain, which is part of our, what they call your adaptive immune system. So you have your innate immune system. And then if stuff slips through the cracks and gets past the innate immune system, you have the adaptive immune system, which is kind of like a more robust immune system that is like your special ops, like you would have in the military. And they have a specific bacteria or infection that they target. And so one belief is that these lymphocytes that are now in the brain decades later could be potentially damaging healthy nerve cells in the brain. So before we move on, along those lines, I did put that poll out on YouTube recently. And the reason I think that why I just went through that is so important is there's some of you that just believe that chronic inflammation isn't really important because it didn't have anything to do with your stroke. Maybe you have what they call a cryptogenic stroke, which means just they don't know what caused your stroke, or maybe you had a PFO with it, or a hole in the heart. For those of you that have had that, you know what that is. And so you don't really believe you had any chronic inflammation or any thing that contributed to your stroke, lifestyle factors that contributed to your stroke. The important thing to understand in your case is that your stroke could potentially have created a chronic inflammation situation, not just in your brain, but it really does affect almost every tissue in the body. So some of the things that we go through when I get to the second part of this video and the lifestyle things that are things that you might be able to do to help with chronic inflammation, it might be something that you want to stick around for and listen to. All right, now just a couple more things about hypoxia and inflammation, or hypoxia-induced inflammatory response, is when it comes to obesity. Now, I know we talk about obesity a lot, but I don't think we always kind of explain why obesity leads to so many chronic diseases. But obesity, or adipose cells or fat cells in particular, if you have kind of an apple shape, that means you have more fat cells around your organs. Those fat cells around your organs, or really anywhere in your body, when they expand, they actually kind of fill up all the space and they create a hypoxic environment, and they will release, or adipose cells have their own immune cells. And in that situation, they release their own immune cells and create, again, an innate immune response that turns into chronic inflammation, where these cells, immune cells, linger too long and start destroying healthy tissues. And then the last thing that I want to mention briefly when it comes to hypoxia-induced or a hypoxia-induced inflammatory response are sleep disorders. The most well-known, or the one that you guys will probably be able to relate to the most, is sleep apnea. Sleep apnea is where you have periods throughout the night where you stop breathing. There's a number of reasons why that's bad. Sleep apnea also leads to sleep deprivation, and sleep deprivation I'm going to go into in another video, but that has a whole slew of its own implications. But I did find some literature that hypothesizes that sleep disorders and this intermittent stopping and breathing throughout the night and creates kind of a hypoxic situation over time. And that can also keep you in a chronic inflammatory state. So just throwing that out there is getting a sleep study, or at least talking to your doctor about it, is really, really valuable. They can order a sleep study, or they can just even ask you questions about your sleep patterns and really get a lot of information and possibly help you to get things to improve your sleep apnea or decrease the number of these hypoxic events that you have during the night, either with a CPAP, or they could go through with you some other things that you could do to help with your sleep quality. So talk to your doctor about that. But again, there is a video coming that is going to go into a little bit more detail on sleep and why it's so important with for neuroplasticity and neurogenesis. So I know there was a lot of information, but in summary, the key takeaways is that inflammation, acute inflammation, is good. Inflammation responds to tissue damage, foreign invaders, or toxins. It activates an immune response. Our immune system will deploy immune cells. Immune cells will come into the area. They will eliminate the causative factor. They will start to clean up the area and they will start the repair process. Bad news is when they linger too long, they start to cause damage to healthy tissues. The way you keep this in balance is that your pro-inflammatory cytokines or immune cells, another kind of immune cell, are balanced with your anti-inflammatory cytokines to prevent this acute inflammatory response from turning into chronic inflammation. The other key takeaway is post-stroke. So anyone who's had a stroke, you have experienced a dysfunctional immune response due to lack of oxygen in those nerve cells in your brain. This could potentially not just cause damage in the weeks and the months following your stroke, but also potentially could contribute to degradation of many neural networks in your brain, even decades after your stroke. So getting chronic inflammation under control is super, super important. All right, so now that we understand what inflammation is, what chronic inflammation is, how do you know if you are someone who has chronic inflammation? Well, some of the signs of chronic inflammation are insulin resistance or decreased insulin sensitivity. So this doesn't necessarily mean you're diabetic, because a lot of patients will tell me that you're not diabetic, but insulin resistance is a precursor for diabetes. And talk to your doctor about that when they're going over your labs with you and ask them, am I insulin resistant? A lot of times doctors wait until things are actually diagnosable before they talk to you about them. But look at your numbers, even get your lab results and go online and just Google this stuff so that you really understand what's going on inside of your body. But insulin resistance is a sign of chronic inflammation, or potentially could be a sign of chronic inflammation. Persisting or recurring infections is also a sign that you have a dysregulated or kind of a dysfunctional inflammatory response. Chronic pain has also been correlated with chronic inflammation. Now, keep in mind, a lot of the stuff that we're going to go over from this point in the video moving forward, there's correlation and there's causation, and it's really hard to kind of tease these things apart. So I may say that this causes chronic inflammation, or this is a sign of chronic inflammation. But a lot of times I think scientists are still trying to figure out, but they do know the things I'm going to talk about are strongly correlated. High cholesterol is also a sign of chronic inflammation. High blood pressure is a sign potentially of chronic inflammation. And visceral fat, or kind of like an apple-shaped body, is a sign of chronic inflammation or is a risk factor for developing chronic inflammation. And fatigue. Now, again, everything I just went through is probably a sign or a symptom for many, many things. I would say if you had 2 or 3 things on that list, there is a high likelihood that you have a dysfunctional immune response and you have those immune cells sitting in healthy tissues or sitting near healthy tissues causing damage. If it's in the blood vessels. If it's in the stomach. If it's in the brain cells. So very, very, very important to look at these factors. Now, the other thing I will say is a high BMI. So a BMI over 30, I really think everyone, especially American, should know what their BMI is. So BMI stands for body mass index, and it's basically just a very gross number or big picture number of your height and your weight, and that gives you what they call your BMI. And there are plenty of charts out there that will tell you what your BMI is based on your height and your weight. And again, anything over 30 is considered obese. And this is a staggering fact that I just happened to find when I was preparing for this video. And I almost did a double take because I didn't believe it, but 69% of Americans, I think as of 2018, which is pre-pandemic, 69% of Americans, that's 2 out of 3 people, Americans, are considered either overweight or obese. So it really is a problem. And I don't say that to shame anyone. I just say that in America, we've almost normalized it because it's the majority of the population. So because of maybe the city we live in or the region of the country we live in, we don't really consider ourselves to be obese just because it's the norm in our area. That's why it's really good to look at these numbers, and your BMI is a great way to keep you accountable or at least increase your awareness of where you stand as far as your health. And remember, this all comes back to promoting neurogenesis and neuroplasticity for those of you who have had a stroke, and for those of you that have MS or Parkinson's disease, decreasing the progression of your physical disability, but also just decreasing your disease progression in general. So now let's talk about lifestyle and chronic inflammation. So first, we're going to just talk about chronic stress. So chronic stress does lead to chronic inflammation. Stress in general is a physical, chemical, or emotional stimulus that causes tension in the body. Stress in general activates our sympathetic nervous system and something called the HPA axis, but both of those things or systems or factors are involved when it comes to stress. That's the sympathetic nervous system is part of our unconscious nervous system that activates that flight or fight response. So when we're in danger, it heightens our awareness to allow us to get out of danger, and then it's supposed to quickly resolve. Or we're supposed to come back down to baseline. So when we're in that heightened state, our brain and our body release cortisol and adrenaline. Again, those kind of amp up our system. Our heart rate increases, our blood sugar rises, and our immune system is suppressed. When we're in a chronic stress situation, that's when this becomes a problem. You do not want these elevated levels of cortisol and adrenaline just indefinitely in your system. And over time, it activates this immune response and keeps us in a perpetual chronic inflammatory state. And one more thing about chronic stress that I found when I was preparing for this video is chronic stress is a risk factor in 75 to 90% of diseases, including cancer, cardiovascular disease, diabetes, and neurodegenerative diseases. So what do? We all have an opportunity, me included, to decrease the experiences or situations which keep us in a heightened state of arousal, i.e. stress. So some things to consider is mindfulness activities. Mindfulness is not necessarily sitting cross-legged, palms facing up in the air, although there is science that supports that, and I'm a huge advocate of that. If you have an opportunity to ever go to like a mindfulness workshop, there is a lot of science that supports all that. But for those of you who are skeptics or who aren't really into that, mindfulness is really just awareness, conscious awareness of your thoughts, and your feelings. So awareness of your inner dialogue or what you're saying to yourself, catastrophizing. Do you say things to yourself like, oh my gosh, I'm going to be disabled forever, or this is the worst situation I've ever been in, or this experience is going to kill me? Those are kind of like our internal dialogue that can heighten our stress response. So being aware of what that repeated internal message is that you're telling yourself. Mindfulness is also just being aware of your relationships and how they affect you emotionally and how you respond to feedback. So if you are working, definitely getting a handle on how you respond to feedback, because you get a lot of feedback when you have a job and you have a boss. So that is one huge area, especially if you work a traditional job, such as full-time, is being aware of how you respond to feedback and maybe addressing that a little bit or reframing feedback that you received so it doesn't turn into something that creates a stressful situation internally. Other things that are helpful for chronic stress are physical activity. Hugely beneficial in decreasing your chronic stress response. I didn't do a deep dive into the literature on physical activity. It's kind of a no-brainer for me. I can just give you anecdotal experience that physical activity is my saving grace. It distracts me sometimes. Sometimes it gives me time to think. It definitely gets my heart rate up, which in turn allows me to relax later on. So there's a variety of things depending on your personality, just emotionally, that physical activity can do for you. But without me doing a deep dive into it, I know it releases anti-inflammatory mediators. So physical activity in any way, shape, or form is hugely, hugely important if you know you are someone who struggles with chronic stress or anxiety. Quality sleep is also important, so paying attention, making sure you're getting the 7 to 9 hours of sleep a night, also very important in reducing stress. We'll also talk about sleep. Again, I know I've already brought it up in this video, but it's extremely meaningful. Sleep is extremely meaningful in several areas when it comes to chronic inflammation. So we'll talk about that again, but definitely when it comes to chronic stress, very, very important to make sure you're getting 7 to 9 hours of sleep. Having a sense of humor, being able to laugh at yourself, being able to laugh at the world is hugely valuable in decreasing your chronic stress. And having hobbies, doing things that you enjoy, doing things that bring your life meaning and purpose, also extremely valuable. If you are someone who's a little bit further on in the disability scale, or you have more physical disabilities, there is something that you can do. Maybe just problem solving would be a way to distract you or get your mind off your chronic stress, to problem solve how you can do those things you enjoy with your current physical limitations. So continuing on, the other area that's important when it comes to chronic inflammation are environmental toxins. So environmental toxins include pesticides, which primarily impact our lungs and our brain. Water pollution, not so much in the US, but if you really get in the weeds, you'll even find that there's certain bottled water brands that probably have more water pollution than others, but I didn't really do a deep dive in that. That was just kind of a skim through an article that I did. But water pollution is also something to be aware of, and just making sure that you're drinking filtered water. And air pollution, so construction sites, an office building, a work environment, vehicle exhaust, agriculture, and household products. So air fresheners, paint, cleaning supplies, and perfumes are all things that you could potentially look into to decrease any additional inflammatory processes going on in your system. And in fact, while preparing for this video, I am a huge fan of the plug-in air fresheners. And after reading a couple of articles, I no longer use those plug-in air fresheners. So there is always room to find something to make us just a little bit healthier. I always talk about this, but it's just finding those 1% areas. And to me, looking into the things I'm inhaling, or the things we're inhaling, or the environments that we're in, and avoiding them if possible, is one area where you can have that, make that 1% improvement. Next area when it comes to chronic inflammation is sleep. And again, I know I've already brought it up several times, so I'll make this quick, but sleep is super duper important when it comes to chronic inflammation and decreasing chronic inflammation in your system, or this bad inflammatory response. Now, how is sleep deprivation correlated? Well, we know that we need to go through the sleep cycles. So there's that non-REM sleep and REM sleep. During that non-REM sleep, we get into the deepest sleep, and there's a point in the stages of sleep where our blood vessels actually relax, and we need that relaxation. Our blood pressure drops, and it literally gives our blood vessels a chance to rest. When our blood vessels never relax, in other words, you're never going through those sleep stages, that triggers or activates this immune response, or this inflammatory response. The other reason sleep's important is sleep deprivation. In several studies that I found, they have done a lot of studies on this, is when they have sleep deprived healthy people, they have found that their glucose in their blood increases and their insulin sensitivity decreases. So simplified, big picture, what that means is there's increased glucose in the blood and there's increased insulin in the blood. Glucose and insulin in the blood in excess amounts causes damage to the blood vessels. And creates this inflammatory response. So 7 to 9 hours of quality sleep is super, super important. The other thing that we know about sleep is that how it relates to cerebral spinal fluid, which is the fluid that kind of bathes our brain, is that the flow rate of cerebral spinal fluid increases while we're sleeping. Actually, the way that the study reported it was that our CSF flow rate decreases by 90% when we're awake. And cerebral spinal fluid flow, part of that involves cleaning out our brain via a kind of a new term that I haven't heard or didn't see a lot until recently. It's like our glymphatic system, which is kind of like our lymph system for our brain. So it cleans out all the toxins. So when that rate increases, potentially you're getting more cleaning going on in the brain, good quality sleep, CSF flow rate increases, more cleaning of the brain occurs while you are sleeping. Long story short, potentially good quality sleep keeps the brain clean. Now, water is also important to talk about, or staying hydrated. When we're well hydrated, our joints are lubricated, which is super important, especially those articular cartilages, to protect those end caps of those bones and not allow them to become irritated, so they create an inflammatory response. But also, water clears toxins from our body, also decreasing the potential of activating that innate immune response. And being well hydrated supports the lymphatic system, which keeps those white blood cells moving. And that is super important. Remember, we don't want those things lingering. Now, let's talk about food. And I'm not going to do a deep dive because this isn't a video on nutrition necessarily. But the reason food's important is because everything that we put into our body, in our mouth, is either pro-inflammatory or anti-inflammatory. And there's really no in between. So when it comes to food, there's pro-inflammatory foods and there is anti-inflammatory foods. Pro-inflammatory foods, big picture, if there's only one thing that you get from this section, is processed foods. Anything in a box, anything that can sit on a shelf for days or weeks at a time is considered a processed food. And also processed meats. Any lunch meat is also processed, is a processed food, and hot dogs are also a processed food. So big picture, if there's anything you take away from this video, those are the things that you want to avoid. Now, if we break that down just a little bit more, the things that are considered kind of pro-inflammatory are trans fats. So trans fats are any fat that is solid at room temperature. The reason trans fats are in so many foods, honestly, if you did not grow it and pick it yourself, it's probably inflammatory. I'm kidding a little bit on that. But really, anything that has gone through a third party from the farm to you probably has something bad in it. But trans fats are cheap, and they also maintain food shelf life. It also helps with the flavor and the texture of food. So that's why they are so prevalent in so many foods. But again, those are any fats that are solid at room temperature. So butter, margarine would be examples of that. Refined carbohydrates are also considered pro-inflammatory. So refined carbohydrate are your white flours and your pasta. So refined carbohydrate is when most of the fiber has been stripped off of that grain. When that happens, food, first of all, that doesn't have fiber helps us to feel full, so you don't reach that full feeling. So that's one downside. But also pro-inflammatory gut bacteria feed off of refined carbohydrates. So that's another reason, is it creates an inflammatory situation in your stomach. Alcohol is probably a given that it is inflammatory. It's actually toxic. So that's obviously going to also trigger or activate an immune response. I already said this, but processed meats as well is also going to trigger an immune response. So that's any of your deli meats and hot dogs. Now let's talk about anti-inflammatory foods. And again, if there's anything, if you learn nothing else from this video, the most important thing to know about anti-inflammatory foods is basically anything on the outside of the grocery store is most likely not processed, except for the deli section, because that's on the outside, I think, of all the grocery stores I go to. But anything on the outside of the grocery store, for the most part, does have a shelf life or is not as processed. So big picture, that would be if you're just in the beginning stages and you are just kind of experimenting with this, start there. Now, if you want a little bit more in depth, some other things that are anti-inflammatory are berries such as strawberries, blueberries, blackberries, raspberries. They're all high in antioxidants. So antioxidants, which we really didn't go into in this video because I didn't really want to go too in depth, but antioxidants decrease oxidative stress, which is also something that is in the same family of kind of like a bad inflammatory response. So they all are considered anti-inflammatory. Cherries are also considered anti-inflammatory. Tomatoes, turmeric, extra virgin olive oil, preferably not heated. Once you heat olive oil, it loses some of its anti-inflammatory properties. So, adding a little bit to salad dressing, things like that is better if you're going to use olive oil. Green tea is considered to be full of antioxidants, so it also is anti-inflammatory. Avocado, fatty fish with omega-3s, such as salmon, sardines, herring, mackerel, and anchovies are all high in omega-3s. So that is another good food choice if you want to increase the amount of anti-inflammatory foods that you are consuming. Now, along the same lines as food, we're going to briefly talk about intermittent fasting. There is more and more evidence coming out every single day as to the health benefits of intermittent fasting. Now, intermittent fasting, big picture, it's basically just eating within like a feeding window and going prolonged periods in a 24-hour period without caloric intake. The schedule that I feel has the most efficacy or usefulness is eating within an 8-hour window and fasting for 16 hours. Now, there's two benefits to this. One is you're going to consume fewer calories. And so for those of you that are more disabled, you're probably not as active. And so it is a good idea when we talked about the adipose tissue and the obesity and all the other things that contribute to inflammation. It is a good idea to restrict your calories a little bit because you're not as active. So that's one of the benefits right away, is that when you decrease your food window, you don't consume as many calories. But the more important one for those of you who want to know a little bit more, go a little bit deeper, and this is still extremely simplified, is something called autophagy. And autophagy is basically just that how our cells recycle. So it's designed to be used in our bodies when we're in a state of starvation. And what happens, or what this autophagy is that it recycles dying or damaged cells and it reuses those components and creates healthy cells. So basically, it's like a cleansing system for the tissues in your body, and it's boosting or upregulating like the healthy tissues that are actually doing good things inside your body. So that is one thing that we know happens when you limit your feeding window. If you have diabetes, there's also a lot of evidence that it also helps with diabetes. But if you have diabetes, do not do this without working with your doctor. You have to build up that fasting window over time, and you have to be in close contact with your doctor, especially if you're on medication that are regulating your insulin. So it can be done, but you definitely want to work with your doctor. And again, you don't go right into fasting for 16 hours. You really do need to build up, because you will bottom out and end up in a hypoglycemic situation. So definitely, if you have diabetes, do not do this without working with your doctor. But just something for those of you who want to go a little bit deeper into this, getting your body in a better state, again, for neuroplasticity, neurogenesis, and to decrease degradation of your nervous system. that's one other area that you could look into. And again, it's all about the 1%. And then, of course, we're going to talk about physical exercise. So I talked about it as far as decreasing stress. They've also done studies on physical activity as well and how it relates to chronic inflammation. And they have taken people that were sedentary and put them into programs where they boosted their physical activity, and those people in these studies had a drop in their C-reactive protein, or CRP, and interleukin 6, which are two inflammatory markers. The exact mechanism as to how C-reactive protein and interleukin 6, how that exactly explains chronic inflammation, isn't fully fleshed out yet, but they do know that those are inflammatory markers, and they drop in people that they've put through or put onto a physical activity regimen. All right, so now that is everything I wanted to talk about chronic inflammation, but there's one other thing I do want to mention, and that is all of you who are either researching or you are doing what I consider novel treatments. So novel treatments would be HBOT, or hyperbaric oxygen therapy, red light therapy, acupuncture, stem cell injections or types of therapies, or you are considering spending lots of your money to go to some guru somewhere who has some medical intervention that claims to get your brain to heal after a stroke, or has claimed that they can reverse your MS. The one thing I would say about that is you have all of these tools at your disposal right now that you could be doing. And if it were me, if you are not doing a good percentage of everything that I just went through, I don't think there's any value in any of those novel treatments that I just mentioned. So any of those treatments that have studies that do show efficacy or do show that they change your disease process in some way, the benefits, according to the data, are so low, they're not really clinically significant, that if you're doing those and you're not doing these other things, honestly, 1000%, I think you're wasting your money. 1000%. It would be like exercising and then going to Burger King every time after you exercise and, getting supersized meal or whatever. I don't eat at Burger King, so I don't really know. But you would get like the biggest meal at Burger King that you could get. Like they are not going to balance out. And the downside when it comes to a lot of these novel treatments is insurance doesn't cover them, so you are paying for them out of pocket. So it is literally dumping money down the drain if you are not doing some of these lifestyle things. The other reason that I made this video, if you made it to the end, thank you, thank you, thank you. I'm not hugely confident that people are going to make it all the way to the end of this video, but if you did, just leave me a comment below saying that you made it to the end, or give me a thumbs up in the comments so that I know. But the other reason I mention this is if you've had a stroke, your risk of having another stroke is double someone age matched to you. So just having a stroke doubles your risk of having another stroke. The other reason I made this video is that if you have children, your children, just because of the fact that you had a stroke, most likely are at an increase. They have risk factors for having a stroke just by the sheer fact that they have a family history of it. So if they're willing to, and you can share this video with them, it would be beneficial to them. And just, I can't stress it enough that the younger you are when you get these things under control, the less damage it does to your body. So I hope you guys found this video helpful. If you're new to this channel and you haven't yet subscribed, definitely hit that subscribe button and turn on that notification bell. Every video is not this long. I do a lot of exercise videos, so I hope that you will subscribe. If you are not interested in this longer content, you will see that I post most of my videos are a lot shorter than this. If you want exercises this week, and obviously you didn't get any exercises in this video, definitely head over to Instagram. I always post exercise videos on Instagram, so you'll still get your exercise fix for this week, or you'll get my suggestions for this week over on Instagram. if you want to get your questions answered, please remember that we have our monthly lives. They're extremely valuable and they're just a lot of fun. And I love answering your guys' questions, and I stay until all of your questions are answered. So information to sign up for that is in the description below. I enjoyed spending time with you all today, and I will see you in the next video. Have a good day.